Thank you. At 9:30, I'll go ahead and call the meeting to order. Thank you for coming in. I know some of you drive a long ways to make it here, so thank you for making the commitment. Nanette, I'm so sorry. She's been a little bit under the weather, so give her a little grace today. She's not been feeling the best. You have an update on our agenda. We had a small error in the agenda.
Right, so I just wanted to say that if you noticed, and you may not have, at the very top of your agenda, it said that you were going to meet here today on September 19th at 9:30. And then about midway through the sheet on the first page, it says under agenda that it's September 20th, 2025. And we didn't catch that till yesterday, and we were talking through our little walkthrough for this meeting. So we have consulted with our Assistant Attorney General for today, which is Heather Poole. Welcome, Heather. And we're gonna consider this, or not consider this, it's a Scrivener's error, because at the top, we do have a phone number and call chair if you want to do this, that, and have any questions and you want to talk. So everywhere we posted it, whether it was downstairs, our website and such, did have the right name. And there was a way for someone, if they were confused, to find out what the right answer was. But we're gonna move forward. I just wanted that on the record, that we did notice it, and we're not trying to violate anything. We just made a mistake. We'll do better next time.
Well, thank you for getting that clarification for us and making sure we are good to go. So, okay, we will go ahead and do introduction of commissioners and do that as a way to establish quorum. So I'll just go around the room, state who you are, and we'll mark that for the records.
Jason Hicks, District Attorney for the 6th District, which is Caddo, Grady, Stevens, and Jefferson counties. The District Attorney's Council representative.
Melinda Front, Director for Oklahoma Rehabilitation Services.
I'm Hannah Whip. I'm the Director of the Oklahoma County Juvenile Bureau, so I'm the Juvenile Bureau representative on the commission.
Brian Larson, I'm the CEO of Lions Meadows of Hope, a foster care agency headquartered in Payne, Canada. I'm a representative of Oklahoma Children's Agency and Residential Enterprises.
I'm Ellen Bittner, CEO of the Oklahoma Healthcare Authority.
I'm Timothy Michaels Johnson. I am the Region 5 Managing Attorney for Child Representation with the Oklahoma Office of Family Representation, which every time is just a mouthful, but I represent the Oklahoma Bar Association.
Kaylee Kurth, I'm the Director of Rural Health at Southwestern. I'm here representing the PAR Board.
Vivian Schmidl, and I'm the President of Oklahoma's Credit Union.
Awesome. Well, welcome today. We're glad you're here. First meeting. I'm John Schneider. I'm the Executive Director of Youth and Family Services in El Reno, here serving on behalf of the Oklahoma Association of Youth Services. Do we have a quorum?
Yes, we do.
Okay, and I will move on to agenda item number 2, public comment. Do we have anybody sign up for public comment today?
No.
All right, no public comment. Agenda item number 3, discussion of possible vote regarding the minutes from the June 20th, 2025 commission meeting. Is there a motion?
I so move.
Second.
Have a motion and a second. Any further discussion? Hearing none, please call roll.
CEO Bittner. Director Front. Yes. District Attorney Hicks.
Yes.
Commissioner Kirk. Yes. Commissioner Larson. Commissioner Michaels Johnson.
Yes.
Commissioner Schmidl.
Yes.
Commissioner Schneider.
Yes.
Commissioner Whip. Yes. Motion passes.
All right, thank you. Agenda item number 4, presentation of the OCCY Parent Partnership Board, and I will welcome up Colleen Howe. Thank you for sharing with us today.
Good morning, everyone. My name is Colleen Howe, and I serve on the Parent Partnership Board. This is my first year serving. I've got 3 daughters, and I am from Central Oklahoma, so I'm from the Mid-Del area, just to give you some context for my experience and where I live. I represent the areas of mental health, postpartum depression specifically, childcare, and early childhood. And I'm particularly passionate about maternal mental health and early childhood programs as prevention strategies. But first, before I share my story with you, I'd like to talk about our new strategic plan. And it looks like you'll see on the screen you have in your packet a one-pager as well as the full strategic plan that the Parent Partnership Board has worked with OCCY staff to develop and refine quite a bit this year. And so first, I just kind of wanted to state that our goal as a Parent Partnership Board is to strengthen child serving systems across Oklahoma by bringing authentic parent perspectives directly into decision-making, policy development, and system improvements. We want to partner with you and with anyone who is working in systems that affect children and families to help serve as thought partners, to help advise on our personal experiences so that you can deeper understand those that you seek to serve. We have on the board parents who represent areas of addiction and recovery, foster parents, parents with DHS involvement, parents who have experienced homelessness, mental health, and more. So we have a wide array of parents who are available to you to advise with and just get to know and help you with whatever you're working on. And so as you look at this report, you'll see some information about our background and history if you're unfamiliar with our board. You see our strategic actions and our core values and some opportunities for engagement. Some examples of ways that we could work together are that we could help review policies and materials that you might be working on. We can attend or present at parent trainings and events, present at events like this today to share our personal experiences. We can serve on work groups and again, serve as thought partners on whatever you are working on. You can scan the QR code at the bottom of this page, and you will also find the full strategic plan in your packet today. I invite you to look at that. It's very robust and includes outputs, the things that we plan to work on throughout each year that will help lead us to our ultimate goal of strengthening systems for children and families across the state. You can reach out to Isabel if you have any questions or feedback on that strategic plan. And we really look forward to working with each of you and helping bolster the efforts that you're working on to strengthen systems for the children in our state. Behind all of these goals and strategies and everything on this very robust packet are real parents with real stories. And I am here today to share a little bit of my story with you all, because our stories are really what are driving all of us in this work to fight for better outcomes for children and families, because we have experienced less than ideal outcomes in our own stories. I haven't counted how many of you are in this room, but looking at the website, there are approximately 17 commissioners as a part of this group. And I would bet that each one of you either is a mom, knows a mom, or has a mom. In Oklahoma, 1 in 6 mothers experience postpartum depression. That means that statistically out of the 17, 2 or 3 of you personally know someone who has struggled with this, whether you knew it or not. And so part of my story is that I was 5 months pregnant when I graduated college. I was the first in my family to earn a bachelor's degree, and I was very proud of the work that I put in. I paid for my schooling on my own with scholarships and through income from my job waiting tables. I was so thrilled that I landed a pretty good job despite being pregnant right out of college. I planned to take a short and unpaid maternity leave and then dive right back into my work. But postpartum depression took me out of the workforce before I ever really had a real opportunity to work in it. I could spend the next few minutes describing what my experience with postpartum depression was to you and how that manifested in my life. But I'm assuming that each of us can at least envision to some degree what postpartum depression is like. And so instead, I really want to talk about the systems that failed, the impact of that, and then propose a solution and give you an idea of how a parent partner can work with you to improve things for children like mine. I ended up resigning from my job right at the end of my maternity leave. My postpartum depression was just out of control. I hadn't sought help for it. I had tried to find childcare, and that process was so overwhelming for me. I didn't know where to start, and I really didn't know how I would afford it being so new in my career. And so I resigned, and looking back, childcare, one very concrete thing that could have helped me so much in beginning my journey to healing and to getting back to the workforce and the dreams that I had previously laid out for myself and for my family. The thing is that I filled out the surveys at the doctor. We all know that there's surveys that they give us when we go to those well child checks and to the postpartum visits. And that is supposed to serve as one of the things that sort of like catches this, like one of the first check-ins, right? I filled those surveys out honestly every single time, and the doctor never looked at them. They never followed up. There was no connection to care. All they ever cared about was the baby, which is fantastic. Every mom wants a doctor who cares about the baby, but we also need doctors who are caring about the mothers as well. And beyond that, I really didn't reach out for help because I had heard horror stories of children being removed and placed into DHS custody. And at the time, I really didn't realize what I was experiencing was postpartum depression and that it is fairly common and normal. I truly thought that I was going through a hard time because I was a bad mom and that DHS would come and take my kids. And I obviously love them desperately. I didn't want that to happen. And because I resigned from my job, I lost my employer-sponsored insurance and I needed to enroll my kids in Sooner Care. During that process, I talked to a couple of different people on the phone, and neither of them ever asked me about what other services I might need that could support my family. But I did get them insurance, and that was very helpful. And postpartum depression did not just affect me. It affected my child's development, my marriage, and it strained the already strained systems that support families. Economically, because I resigned, I missed out on years of experience, wages, contributing to Social Security and taxes, and my own retirement. And my kids stayed on Sooner Care longer than they would have needed to had I been able to get back to work and get employer-sponsored insurance. And I really want to highlight the early years of development because this is a passion of mine and it's the area in which I work professionally now that I've come out of all of this. We know because of research that 90% of a child's brain is developed before they walk through the doors of their kindergarten classroom. It's a critical period of development for children where they're learning the entire foundation of who they are as a person, how they interact in the world, their mental well-being, and their trajectory for their education. But because of my untreated postpartum depression, I really struggled to nurture my children and to respond to them in ways in which supported their development. And because of that, my oldest child did need intervention when she reached kindergarten. She was behind many of her peers. And again, that strained state systems to support those interventions. Beyond these very tangible things, my marriage suffered, which could have led to divorce, which is something that our state cares about. There's a lot of talk about that here in Oklahoma. I also struggled with alcohol use disorder, which is really hard for me to stand here and admit to you all as a professional currently working in this work. And maybe even the worst of all is that I lost my desire to live at times. My depression persisted far beyond those first 6 or 12 months of the postpartum period. And it had compounding issues, right? Like I can't speak to my husband's experience specifically, but there are men in this room. There are probably dads in this room. And I just want to speak to that to say that I know my postpartum depression affected my husband and that affects the entire family unit. And his challenges have persisted beyond the postpartum period as well. So there really are compounding issues whenever we don't address these things early on. And filling out a paper at a doctor's office did not catch this for me. And I'm not alone. So I want to share some quick statistics that in Oklahoma from 2016 to 2019, only 54% of new mothers were screened for postpartum depression. And maybe most surprisingly, mothers with a bachelor's degree like me or higher had the lowest screening rate at only 50.6%, despite having the highest postpartum visit rate, meaning that they showed up to most of their visits. And in 2024, Oklahoma received a D grade in maternal mental health for provider availability and for screening efforts. And nationally, suicide is one of the leading causes of maternal mortality in the first 12 months after having a baby. just to address the stigma here a little bit, because we all know that there is stigma. I have been told that I don't look like someone who would have struggled with this. And that's why I'm here speaking with you all about this today, because postpartum depression does not have a look. And all moms face different types of stigma based on the communities in which they live and where they work and how they were raised and what cities they were raised in even. And if I struggled with it, I cannot imagine how much more difficult it is for moms with fewer resources and who face greater adversities than I did. So we know there's a lot of talk in our state about intervention strategies because we want to address the needs of children and families after really big events happen. And these are things that cost the state a lot of money. I don't think that there's any way we can negotiate that fact. And it's a lot easier to see those challenges and those things that we need to address. But what I'm talking about is prevention, so that we can catch some of these families before they fall and before they need these more costly interventions. And I also want to acknowledge that Oklahoma has made strides towards better maternal mental health through the Medicaid expansion to support moms up to 12 months after postpartum so that they can seek mental health services, and also the Choosing Childbirth funding that came out recently, supporting programs to help moms get the support that they need. But what about moms like me who filled out the surveys and no one ever followed up? What about the moms who are falling through the cracks because they are interacting with certain systems like Sooner Care, but nobody's having a genuine interest in how to better support the family? Or what about the low trust in the systems that are supposed to serve our families? So my call to action is that every system that interacts with mothers of young babies, whether it's healthcare or childcare or special services, should proactively engage in ways that build trust and identify needs to connect moms with care. An example of this could be a thorough and genuine needs assessment at well child checks or postpartum visits or at any system interaction with a mom of a young child, and have that needs assessment integrated into a closed loop referral system that ensures that moms actually get the care that they need. And my overall statement here is that maternal mental health must be treated as a public health priority and it must be taken seriously. Postpartum depression is not less important because it only lasts for 6 to 12 months, because I'm an example of that not being true. It's not less important than the visible things like addiction, homelessness, or psychosis, because left untreated, it can lead to those things. And so I ask each of you to just think about different ways in which you work that can serve as prevention for greater issues for children and families later on when they don't get the help they need. And finally, I would like to remind you all to reach out to us if there's anything that we can do to help you. I mentioned earlier the different experiences that we have on our board, and we are currently, I think, opening applications soon to get more parents involved. And so we really want to be a resource to you and would be more than willing to share more of my story. And I know that many of my parent partner colleagues would do the same. Does anyone have any questions? I don't know if I'm supposed to ask that, but I am. No, okay. Thank you so much for your time.
Thank you so much for your presentation, but also sharing your story. I know that takes some courage sometimes to get up and just be open and real. So I really appreciate your willingness to do that and serve the state through your story and through your work. So thank you.
Thank you for the opportunity.
Absolutely. Okay, we'll move on to agenda item number 5, discussion of possible vote regarding the finance report. I'll turn it over to Mahmoud Al-Had. So, right. I have to love technology. Don't you?
Yeah.
Sit down, Steph. How did I close the whole thing? Oh, I'm sorry.
There it is, bottom left.
Thank you. Good morning, and respected commissioners and their colleagues. Thank you for joining today's meeting as we review the finance report for the fiscal year 2026 as of August 31st, 2025. I'm Mehboob Haq, your business manager, and I am honored to take you to the financial activities or report at this new financial year. Let's take a look. So this is a snapshot of our total financial progress at this point of time. Our total annual budget for this financial year 2026 was 5.8 million. And our total spending at this point of time or utilization is $520,393 as of August 31st. And it makes 9% utilization of the total budget. And if you see respect to the year-to-date budget allocation, it is 53% of the utilization. Spending appears low, but this is typical at the start of the financial year. Personal cost and administrative expenses gradually accumulate month by month, and while program-related disbursement and contracts are scheduled later in the year, so that's why it's at the start of this year, it's not a bad utilization. This is overall the category-wise spending detail as per the accounting manual. The 5 major categories here. Personal services, we have utilized 12%. Travel expenses, we utilize 6%. Administrative 7%. Property, furniture, equipment 4%. And grants and program-related, we haven't utilized any money up till now because they are scheduled later in the year. So overall, administrative and personal costs definitely they will naturally rise in as the year progresses. Lower spending in property and grant expenses or grants reflect basically timing of the purchases and program disbursement. So that's not considered up till now. It's not underutilized. This is spending distribution. 94% is our personal services expenses. 1.47 is travel, administrative expenses, and property expenses. They are as like 3% and 1%. A little more detailed look. You can see the percentages overall view. Total disbursement is 9%, 3% is for the year-to-date budget. In comparison by graphs, if we look at the department-wise utilization, so here are the few, all the department with their utilization. Administration is highest at 11%, planning 9%, MTTs 12%, CDRB 13%. So it's like a detailed view as per the department. Same information with little visuals comparison. Our spending up till now for the 2 months is $520,393. So at this start, so it is taking up later in the financial year with the program activities. Definitely, it will go up, but overall, the spending is as per our plan and as per our expectations. So total accumulated expenditures are 520,000. This is our cash status, cash balance. We have appropriation funds for the 2024 year, financial year 2025, and financial year 2026. So the balances from the appropriations shows that, and it makes total 815,828. Overall, these balances ensure we are equipped to manage our financial year 2025 closeouts and ready for the current financial year 26 operations. Detailed reports, system generated reports are included with the packet. So they have a lot of numbers. If you have any questions or want to have more, we can discuss on it. Just the key financial activities during these 2 months. We have completed the indirect cost analysis report for the 2 years to make up what are our indirect costs. We have submitted the budget revision for the 2025 year for release of invoices related to the IT and CAMTA funds. We have spent out all the CAMTA funds for the previous years. So you have seen the balance on the CAMTA funds is 0. So up till now, it's everything is cleared out. We were working on some documentation regarding to the gap packages and budget submission for the next financial year 2027. So we were working on that. Invoices has been paid out for the last years. We are strengthening documentation and compliance for the previous year and opening of the current financial year. In conclusion, overall, OCCY financial performance through August 2025 reflects as per our plan and healthy and smooth and ready for the financial year 2025 closeouts. Thank you very much for your continued support. I am happy to address any questions to provide additional details on today's report or the reports included with the packet.
Thank you. Does anybody have any questions? No questions? Is there a motion?
Move to approve.
Second.
Okay, motion to approve in a second. Any further discussion? Hearing none, please call roll.
CEO Bittner, Director Front,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurth,
Yes.
Commissioner Larison, Commissioner Michaels Johnson,
Yes.
Commissioner Schmidl,
Yes.
Commissioner Snyder,
Yes.
Commissioner Wood.
Yes.
Chair. Okay, thank you. Mahmood, thank you so much for your detailed report. We appreciate it.
Also haven't recognized him yet either.
You can vote.
Even though he came in late, but he is present, so.
Okay, we can, okay.
I also vote yes.
Welcome.
Sorry about that. Okay, moving on to agenda item number 6. This is discussion and possible vote regarding the state fiscal year 2027 OCCY budget request. And I will turn it over to Mark James.
Good morning. I visit with you today for our state fiscal year budget request, which is due October 1st. So we have spent the last several months and weeks at examining our needs as an agency so we can successfully perform the many responsibilities we have in statute. We consulted with our OCCY Finance Committee here the past couple of weeks. So thank you to Director Cartmel, Director Front, Commissioner Hall, and Commissioner Schmidl for going through this information with us and providing us feedback and your perspective. Are you going to control that or do I?
You can.
I have a few slides and I'll attempt to run through it. We have prioritized what our requests are. So our state appropriations, as you may recall, is $3.1 million. We receive that amount annually for the past couple of years. And so this request that we're pursuing is an increase of those state appropriated dollars. Our total budget is about 5.6 million. Mahbub just went over that and the number just escaped me. But with partnerships and other funding sources, our entire agency budget is 5.6 million. But of the state appropriations that we receive, it is $3.1 million. And so this request is going to be in addition to that $3.1 million that we receive through state appropriations. Currently, of that $3.1 million, 94.8% of that pays for the payroll costs of our employees. The additional gap, which it leaves $210,000, is what's remaining after that 94.8% is expended, goes towards 3 items that are already earmarked by the legislature. We've made some requests in the past few years and to the legislature, and they've granted those. So 3 items that they've given us specific funding for, and that's for our chief child abuse medical examiner to conduct maltreatment reviews of child death or near-death cases and at the time of the event. We've also asked for money for our juvenile competency evaluations, and they've given us $60,000. And we've also asked for funding to pay for our data system, a contract with OU, and they've given us funding for that. So if we spend that 94% towards personnel costs, use these 3 other portions of funding, we've got no dollars left to pay for required fixed costs of just to operate as an agency. So that's going to be a big piece of what this request is about. So our total request is $1.6 million. And that's a big number for us as an agency. But we have, again, examined what we feel, what statute directs us to do, to accomplish, and what we need to just to operate as an agency. And so we feel like this is an important ask, important need for us. We're not trying to, create bigger things. We were trying to fulfill the things that we're required and obligated to do. So I'm going to have a slide for each one of these items, and we've listed them as a priority. And so we will start with request number 1. That is what that is, right? So this is for operational costs. As I mentioned before, payroll takes 94% of our state appropriations, and then we have the other three other projects that we are wanting to carry out. But that leaves us no money to pay for fixed costs. Things such as our required costs for OMES. We have their contract with them for our financial services, for our human resources work, and for our IT connections and that, and we have to pay for our laptops, we have to pay for rent. So we've got no funding for those. Therefore, we have to seek partnerships and other resources to cover those. So that's what this request is going to be. So Mahbub has done an excellent work on this and other projects to help us identify what those true costs are. So this $32,000 is the exact cost of what, or the actual cost of what those overhead costs were for us last year. Now we know that's going to, as all costs have increased, which is part of what we've gotten us in this space we're at, because costs have increased so much over the years, and we've been able to cover those. But as those costs increase in the world, we've got no additional resources for those. So $342,000 reflects the actual cost for all these mandatory things that we have to do just to operate as an organization. So our proposal is to go to the legislature asking for the costs just to operate as an organization. And I've got a bit of information there. And again, this is all in your packet. We've got this identified and I've broken down by each request in the packet for you. And I did want to highlight that Mahbub mentioned that he spent quite a bit of time looking at our indirect costs. One of the things that we've not done in the past is we have contracts and partnerships with other state agencies and other organizations. And we're happy to do that work and we're happy for those partnerships, but we've never included or factored in the indirect costs. They just absorbed all the administrative component of that work. Well, we're at a point where we can no longer do that. So we are going to have to be implementing an indirect cost to all of the services that we do. So we're going to be asking our partner agencies to pay for those things that we've not done in the past. But we feel it's necessary just to complete the work that we have in front of us. So that is request number one. Let's go too far. I can't see with the glare here very well, so I apologize. Request number two is for a salary adjustment plan for us as an agency. You may recall we approached you all last year and the legislature with a salary request for our employees. Obviously, our employees are the backbone of our agency, as with all. And so we feel like we've got a quality group of individuals who are dedicated. Many of them have been here for a good long while. And we, again, last year asked for salary increases. We took that request to the legislature, and after our budget hearings, essentially retracted that request, and I think somewhat regretfully. But this year, we're going to move forward with it again. We require, and I've said the same thing for many times when I'm up here, our staff have to be seasoned and experienced to do the work that we charge with doing. We can't often hire someone's brand new out of college. We need some folks who've already understand how systems work, because our role is to examine all the other agencies and other systems to examine their policies and their procedures. So we have to bring in seasoned folks. Sometimes, because we're a small agency, we don't have a large workforce. And so our managers and our folks may not have a large number of employees under them. So when we compare ourselves to other agencies that do have several layers of employees, it's hard to compare our folks to those other agencies. But our scope is just as large. We have statewide coverage. We're responsible to provide oversight to every juvenile facility. We work with families in every capacity across in every county in the state. So we have to hire seasoned, experienced folks to come on board, and we need to retain those folks. So obviously, high turnover increases costs, and so we want to reduce that. Something.
Just got informed that it's not being shared with the rest of the.
Presentation isn't being shared on Zoom. Just to continue that conversation, OMES, as a result of House Bill 1794, was directed to do an examination of the pay structures for all state employees. So they did that, and just this past year, they issued a report of their findings. And they restructured or reclassified state employee employment pay structures across all the states. And in doing so, they made some adjustments. And part of that requirement or that result was a directive from OMS for us to get to 90% of the comparative pay structure for each position. Well, our positions are not anywhere near that 90%, as most agencies are not. So we're in the same boat. So just a couple of examples I just wanted to share. So part of this project that OMS did, they created a pay band for agency directors. And there are 5 different levels of agency leadership based on the size and the scope of that work. And obviously, we're a smaller agency, so we're looking at that smallest agency level. The high end that the OMS directed for payment should be $169,000 for an agency. 90% of that, which is what we're charged with trying to get to, would be $141,000. Currently, we pay $109,000. So that example translates to pretty much every position and role that we have within the agency. And so this request that we're presenting does not get us to that 90%. It just moves us a little bit closer. We believe it's a smart strategic approach. We've not just doing an across the board increase. We've looked at each position and the education experience that it requires, and we've made adjustments according to that position. Another quick example, we're about to hire a brand new injury prevention coordinator. It's a brand new role that we've never had in the Child Death Review Board. This person joins us with great education, a master's degree, and several years of experience doing the type of work that we're going to ask them. And we're bringing them on for $55,000. But we've done an examination and comparison and state agencies for the same kind of role. $61,000 is the typical rate for that role. And so we're behind that. So those are just a couple examples, and that fits and that translates to most of the positions that we have in the agency. And so again, priority number 2 is for a salary increase or a salary adjustment plan for us as an agency. If you have any questions along the way, please raise your hand or raise your hand.
What is the average increase that we are looking at across the board, or do you know?
That is a good question. And I did not pull that together. Do you? I believe, and it's been several months since I dove into it directly, but I believe it's about 9% would be the average. But
and what percentage would we need in order to get to that 90%?
I do not have that answer.
Okay. I'm just curious as to, is there a reason we're not wanting to explore going to that full 90%?
I believe our thoughts were, we're considering the dollar amount and what's potentially a realistic, achievable ask. And I feel we're that 90%, this number would be significantly higher. For example, because the agency director, 141,000 would be the 90%. We're not asking for anywhere near 141,000. We're just asking for an increase to what it currently is. So I think the number would be pretty.
Just for some rough math, I think our personnel budget's around 3 million. So, this increase would be around 8% of total personnel budget. I don't know how that translates per staff, but that's the percentage.
Well, I don't have the specifics, but I can definitely work to get that. Priority number 3 is for our Office of Juvenile System Oversight. As you're all aware, we're charged to respond to complaints and provide investigations of facilities across the state. And this is a large charge, large work, lots involved in that activities. But our staff they have pretty large caseloads currently. But in addition to that, this past year, there were 2 statutory changes that occurred. Senate Bill 872. This was not a request of us as an agency, but it makes some pretty significant changes to the role of OJSO. The statute states that now, when there is a complaint at a facility where a staff has done some maltreatment or abuse to a juvenile in a facility, we, OJSO, is now supposed to conduct a real-time investigation and provide a report to the district attorney. You can imply that means so that the district attorney can determine if there's a need for charges to occur. So you can then imply that means there's going to be some timeliness involved in this, which changes the OJSO's traditional or historical role. We've always been after the fact. We've been examining the systems, examining how DHS concluded their investigation and all the other partners. So we're kind of, in a sense, a step behind everyone, examining how it all worked. The statute change puts us in the middle of a situation immediately. No resources were provided, just the responsibility was added to this task. House Bill 1574 was passed, which was a request of ours. As you recall, we have had in the past been able to go into privately operated residential facilities in the response to a complaint. Only when someone reaches out to us have we been able to go out. Well, we asked that we expand that so we can go to any facility without a complaint being required, which thankfully we were fortunate and granted that opportunity. But with this request also was accompanied with a request for additional staff. So we got the responsibility, but we didn't get the staff. So in addition to our OJSO continuing the work that they've got, we've got additional tasks and responsibilities. And so that's largely what's framing, well, that's a piece of what's framing this request. We're asking for 3 FTE. One of those being a director for the Office of Juvenile System Oversight, which historically this agency has had up until about 2012. That position, because of budget issues, was done away with. Once the position was vacated and never filled. We feel our Office of Juvenile System Oversight requires direction and leadership that Annette and I attempt to fulfill, but with the many tasks and responsibilities that we don't believe we do not give it the attention that it needs. So we're asking for a director and 2 investigators to get closer to accomplishing the many tasks and responsibilities our OJSO office has to fulfill. Request number 4 is juvenile competency evaluations. Courts order that evaluations occur on juveniles who've been charged with a crime, and someone raises the question, is this juvenile capable of understanding the charges and the process that they're about to be engaged in? We, since the statute went into effect in 2015, have been paying for these evaluations. We're not required to. No agency or entity is required to, but we have taken on that role to make that happen. 3 years ago, we went to the legislature for the first time asking for some funding to pay for those evaluations. They did. We were very happy for that. They gave us $60,000. And as I mentioned earlier, that's one of the earmarks that we have was $60,000 for those juvenile competency evaluations. But that $60,000 got ate up quickly. This past year, we had fiscal year 25, we had 76 orders issued. The year before that, we had 79. So so that $60,000 does not cover. We've been, for the past 2 years, been right around $100,000 that's been costing us to pay for those evaluations. We have gone to the courts. We've visited with Judge Warren and his counterparts, and they are all rely on this work to occur. So we feel that if it needs to be fulfilled, it's in statute to happen. We want to go to the legislature asking for $45,000 just to cover the cost of what our past 2 years' experiences have been. If it increases, if those numbers or the court orders rise, obviously that $45,000 may need to rise at some point as well. Request number 5 is for regarding evaluations and reports. If you examine our statutes, you will see that we as an agency are responsible for a large number of reports that we are to submit to the commission, or that the commission is to submit to the legislature. Our staff are great at doing their work and great at reporting the best that they can. But there are many ways when we are not capable of creating the documents that we feel truly reflect the work that is done and report out on the work that the legislature's dollars or the taxpayers' dollars have been used. So we feel we want to be responsible and accountable for reflecting the work, showing how the work or how the money is being utilized. We've been using funds and resources from other areas to pay for these, but we, at this point, are wanting to ask that we receive $56,000 to pay for these evaluations and reports. We utilize the University of Oklahoma's E-team, which stands for Educational Training and Evaluation Assessment and Measurement Department, where this is what they do. They evaluate programs, they develop reports, and so we've relied upon them for the many of the documents that we've used, and we will continue to. But we were going to ask the legislature to see if they could assist us in covering these required reports that we do. And here's a breakdown of some of those reports. And this is just the ask right now. There are additional reports and responsibilities we have as an agency, but we feel like these are the priorities for now that we're going to move forward with in our request.
Mark,
Yeah.
are all of those reports, are we statutorily required to give those?
Yes. Statute states that either annually or on other sort of basis that we are required to submit those.
Okay, so regardless, we have
This is
that.
just a few. Request 6 and 7 are combined here. And they're only combined because we're asking for these are two FTE that we're requesting, and they're not related to one another. The first one is the endowment developer. 2018, the legislature created the Oklahoma Children's Endowment Fund and gave that responsibility to us as an agency and to you as a commission. The idea, not the idea, the construct is that it's a private and public partnership. Private funds are received, put into this endowment. Those funds are then come to you all to decide how to disperse them, how to utilize them. And these are 4 things for pilot projects to bring in 5 ideas. They're not to be utilized for core services as for any entity or agency. Other states have found great success in the use of this trust fund concept. And we have considered it and thought about it and talked about it, but there's been no legwork done to make this happen. It's been in the statutes in 2018. We feel it's time for it to happen. We feel like if we identify a position who can focus, who can frame this need and this want and successes of it in the other parts of the country, we can create this endowment fund that you all can work with our parent partners and our other organizations to figure out how to determine the best use of those. So we're requesting for a 1 FTE, and that cost right there is for the salary, benefits, and all the overhead related costs associated with a position. And I will put.
Can I just add one thing? Just to be clear, any funds that would go into that endowment, the only thing that would be dispersed would be any revenue generated from it. So the corpus wouldn't be spent. If we ended up with $100,000 by hook or crook one day, we'd have a penny to spend that next year on the revenue. So as an example, our counterpart in Michigan has had a longstanding endowment, and they have $26.5 million in it, and they dole out $1 million a year on the interest generated, and it goes out to support family networks. Car manufacturers over many decades have contributed to that, and the idea in the beginning was, in 2018, the world was very different, if you remember. Maybe oil and gas or some people like that might want to put a little money here and there, and then it would sit there, and then you as commissioners, I don't know if it would be us. I mean, I may be long gone before and I mean that literally before there's anything to get too excited about, but if you don't build it, there's no place to put it. So that's how that looks. I just wanted to be clear. So if anyone out there in the virtual world is getting excited, there may be lots of money to spend one day. It will be a while, I bet. So I just wanted to kind of tamper enthusiasm for coming to OCCY for a lot of funds. So.
But if we don't have the
If we don't-
resources and the manpower to work on it,
Exactly.
we'll never have it. Well, this is a great resource that some point. The second position is our Post Adjudication Review Board Tulsa coordinator. He's going to talk about PARB here in a bit later. But statute requires that we have these review boards across the state, and statute says where those review boards are, they are required to review every deprived case once every 6 months in their area. Tulsa County, large area, we don't have the review boards, we don't have the volunteers that it takes to accomplish that. fortunate, we have a position in Oklahoma County. Shelby's our Oklahoma County Coordinator. And the success that we've seen with her in that position in Oklahoma County demonstrates to us that we need to have that same success in Tulsa County. So we are requesting for a full-time position in Tulsa County to conduct that statutorily required work. Currently, we contract with the County of Tulsa for a part-time person to navigate and coordinate the few review boards there, but we need it to enhance significantly. And we're asking for a position to fulfill that. Children of incarcerated parents. Two items that are somewhat related. Statute has established the Oklahoma Mentoring Children of Incarcerated Parents Program, and it falls under OCCY. Part of that, there's a work group that our Office of Planning Coordination takes the lead on, and then we also are required in statute to issue a mentoring RFP every few years. We have a great partnership with Big Brothers and Big Sisters of Oklahoma. We want to continue that. We want to continue their great work and ideally enhance that someday. But in addition to the one-on-one mentoring described in the statute, we want to enhance that. We feel like there are additional mentoring services that are needed for this population. We want to expand to group mentoring, peer mentoring. Our Office of Planning Coordination has had a great success this past year with Office of Juvenile Affairs with some online mentoring. This is training for mentors. Our partnership is having to be reduced this coming year because of financial issues, or budget reductions. We want to enhance that. In addition to that, we want to be able to provide technical assistance to all these services who do provide mentoring. And with that, so we're asking for a CIP coordinator, someone who can lead the work group of our folks and all this group work, manage the contracts that may hopefully be attached to this if it comes to fruition. Then also $100,000 are asking for the expansion of those mentoring programs. Would be expanding contracting potentially for group mentoring, for peer mentoring programs, contracting for this online training for mentors. So those are our 9 requests, and we've listed them in priority. We will go to the legislature, we believe, listen in this priority, and in the past, they've elected some things to move forward with and some not. Sometimes they've elected to move forward with none. But this is what we're asking for, $1.63 million for these items. And again, we don't believe that we're creating anything new. We're just trying to fulfill many of the things or the things that are in statute for us to carry out. And just as highlighting and emphasizing why we feel it's important. We feel like investing in these things is not an investment in us as an agency. It's just giving us the resources so that we can enhance the investment that is needed in our children and in the families. So with that, I'll take any questions or about our request.
I have one. Your number one priority increase for your overall operational costs, is that the increase that you've seen in operational costs this year, or that's your total operational cost?
That is our total overhead costs from last year.
Okay, so I guess my question would be, how did we pay for it last year? Because I'm concerned that we would go into this new year saying we can't pay our rent. So how would we, and I know that's a very layman's terms way of saying it, but what are we, like, if you don't get that, what will you do and what will you have to cut?
We've been able to, thankfully, to have partnerships and rely on reimbursements. Most of what that is covered is with from the federal government, relying on federal funds. Our work of OJSO, PARB, MDTs qualifies for reimbursement with federal 4E funds. And so every quarter we have to calculate all the work and expenses. We submit that to DHS, who then submits to the federal government on our behalf, and we're able to get reimbursed for those funds. The rate for that reimbursement has shrunk. So we're getting fewer funds. It's not drastic yet, but we kind of see that there's a trend occurring. So currently that's what's happening. But if our workload changes, the federal requirement changes, that goes away, and we've got nothing. Because I was about to say we have other partnerships with other agencies, but those are for specific activities that we agree to do to perform for them. So currently, we're relying on the reimbursement that we get for the work that occurs here from the federal government.
And
I had a quick comment. Just in serving on the finance committee and visiting with Maboob and Mark, I was struck by, it seems that the team has been able to do a really deep dive into the numbers of what's required to execute on our mission and to do the things we've been tasked with doing, but also keep the lights on. And so just anecdotally, it seemed to me like they've got a really good grasp on these numbers and that these requests are based in reality and just doing what we say, well, doing what we've been tasked to do and what we say that we're supposed to do. So it's just a comment, not really a question.
Thank you. And I would just, if I could just piggyback on that. We've been able to do this because we have Maboob, his knowledge and his skill and his ability to do so. And he's a business manager. He's not our CFO. We have to rely on OMS to really do all of those things. And prior to Maboob, we couldn't do this deep dive. We didn't know how to do that. But now we have his skill set. But quietly, we're not going to be able to afford Maboob for much longer because of all the skill and ability he's got, and paying him as a business manager and not as a CFO. So it's with the salary issues that we're dealing with.
Yeah, I would just say, as a young program administrator at the Oklahoma Alliance Boys Ranch in the early 2000s, OCCY had a tremendous impact on me. In fact, a name is kind of burned into my brain of Dana Holden as this investigator that showed up unannounced. And I had no idea who OCCY was or why he was there. I understood licensing and contract reviews, but this guy shows up and says, I want to look around. And I pretty quickly realized that he had the authority to do that. And I will just say it had an impact on me because he was there to say, I'm not just looking at if you have met requirements of licensing. I'm not just looking at whether or not you've met requirements of your DHS contract. I'm here to just look at your program and take a really qualitative look at it. And it was intimidating and scary, but it was over time. What it turned out to be is just really helpful. And we found that OCCY really was a partner with us to help us make sure that we were caring for children, not just on a minimum standard, but really working towards maximum standards. And I'll say that's gone. We don't have those visits that just show up to help and look and be a quality. It's more reactive. And I think we all could agree that being proactive costs less.
Yep.
So.
thank you.
I'll just say with that in mind, my only concern, there's a couple of discussions of enhancing programs or adding on to current programs. And I recognize the importance of doing that. I want to make sure that we're not doing that at the risk of loss of retention of current employees and staff and the work that we are currently doing well. I want to, recognizing that we're nowhere close to the recommended 90%, that's just something that I would be concerned about because I don't want to have those losses. So I recognize there's been a lot of thought put into this, and so I'm not frustrated with it. I just wish we could give more to personnel. And so I don't know if it's appropriate to ask for more to increase that personnel piece of it. Instead of a 8 to 9% increase, increasing it to a larger percentage, but those are just my brief thoughts.
Any other questions, thoughts, comments?
I move approval.
Motion to approve. Second. Any further discussion? Hearing none, please call roll.
CEO Bittner, abstain. Director Front,
Yes.
Commissioner Hall,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurth,
Yes.
Commissioner Larison,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Schmidl,
Yes.
Commissioner Schneider,
Yes.
Commissioner Witt.
Yes.
Motion passes.
Thank you. Mark, thank you very much for your presentation and also you and Maboon for the work you put into doing that so that we can have discussion and vote with confidence that we're moving in a good direction. So we appreciate you very much. Okay, next on the agenda is agenda item number 8, discussion and possible vote to fully approve, fully credential candidates in accordance with a. Oh, I'm sorry. Did I miss one? Oh, I missed one. So sorry. Number 7, discussion and possible vote to elect the following commission officer of secretary. The last meeting when we did election of officers, I had not done the due diligence to reach out to Commissioner Hall. And so, anyway, we need to, I've spoken with him and he's going to serve as secretary again. And, I would entertain a motion to do so.
Move approval.
Okay, a motion and a
It's down there.
second. Okay, motion and second. Any further discussion? Hearing none, please call roll.
CEO Bittner,
Yes.
Director Front,
Yes.
Commissioner Hall,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurth,
Yes.
Commissioner Larison,
Yes.
Commissioner Michael Johnson,
Yes.
Commissioner Smidel,
Yes.
Commissioner Schneider,
Yes.
Commissioner Witt.
Yes.
Motion passed.
Perfect. Thank you. Thank you for your service. Appreciate it. Okay, now we'll move on to agenda item number 8. Discussion of possible vote to fully credential candidates in accordance with the OAC and recommended by OCCY Juvenile Competency Professional Committee. And I'll invite up Richard Uhola.
Morning. On June 20th, a month ago, we presented to you this candidate for being approved as a provisional evaluator for the juvenile competency evaluation program. And as of today, we have, let's see here. We have a candidate who has completed the process of providing a provisional evaluation. And also her name has been presented to the Juvenile Competency Evaluators Professional Committee, which met last week and was approved and recommended for final approval as a full-time evaluator for the juvenile competency program. And what I imagine requesting this morning to the commission is that her name be brought up for consideration to be approved as a juvenile competency evaluator for the juvenile competency evaluation program.
Any questions? Is there a motion?
Make a motion.
What's the motion? Motion to approve. Brian, is that your motion? Motion to approve? Okay, thank you. Motion and second. Any further discussion? Hearing none, please call roll.
CEO Bittner,
Yes.
Director Front,
Yes.
Commissioner Hall,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurth,
Yes.
Commissioner Larison,
Yes.
Commissioner Michael Johnson,
Abstain.
Commissioner Schmidl,
Yes.
Commissioner Snyder,
Yes.
Commissioner Witt.
Yes.
Motion passes.
Okay, perfect. Thank you. Thank you very much. Okay, agenda item number 9, discussion and possible vote regarding the proposed status of the freestanding multidisciplinary teams for 2026. And I'll invite up Brittany Gassner.
She's actually going to join us virtually. She's
Okay.
on vacation.
Good morning.
Morning.
Okay. So this morning, I know we have some new commissioners, and I'm going to start by kind of explaining how we get the freestanding multidisciplinary teams and what that process kind of looks like, and what the difference is between a freestanding team and a team that's associated with the Child Advocacy Center. So Ellen, if you will put up the presentation for establishing a new freestanding team.
Can you see it?
I can, thank you. So we can go ahead and go to that first slide. Maybe if I can get to it. So the freestanding teams are actually required by statute, and they are made up of a member of the district attorney's office, law enforcement, child protective services, medical personnel with child maltreatment experience, a licensed mental health professional, and then there must be a dedicated team coordinator. Now that coordinator can actually be a member of any of those core disciplines, or it can be somebody else entirely. And the whole reason that they're there is to promote that joint investigation between law enforcement and child welfare, and to collaborate an effective response to those child maltreatment investigations, and to ensure that the cases don't fall through the cracks and that the families and the children are getting the services that they need through that process. There are some differences between a freestanding team and a child advocacy center based team. First of all, a freestanding team cannot be part of a child advocacy center for accreditation purposes. They do focus on that collaborative investigation and support of the family. Most of these teams are found in the very rural areas of Oklahoma. Doesn't mean that they can't work with a child advocacy center. In fact, several of them do. But they find ways to work together and investigate these cases in their communities. We have some great child advocacy centers in our state. In fact, we have 21 of them. But they have very specific accreditation standards that are set nationally that you'll find in rural Oklahoma. It's very, very difficult for them to meet those standards. And statute actually only allows one child advocacy center per district attorney's district. So when you kind of figure that out, sometimes it gets really, really difficult for families to get to a child advocacy center. Western Oklahoma actually doesn't have any child advocacy centers once you get past Canadian County. I think right now the furthest one west is in Duncan, Stevens County, and that's actually only a year old. So it's really kind of sparse when you get out towards Western Oklahoma. But excuse me. Thank you. So by statute, OCCY, because we have oversight of the freestanding teams, we work in conjunction with district attorneys to get these teams set up. We collaborate with the district attorneys, the elected district attorneys, and collaborate to ensure that they have those teams. Statute says the district attorney must have an MDT in each county or contiguous counties within their district. And each area has to be served by a team. So go ahead and move to the next slide. We do have, I have a map later on that actually is more updated than the one that's on this slide, because we've actually grown some. But the timeline for the teams is January to July. So for most new teams, we get that call from a county that doesn't have an MDT and they say, hey, we'd like to get one set up. What do we need to do? The very first thing they need to do is they need to talk to the elected DA to get their blessing, because we can't do anything without that DA saying, yes, I want a team here. Once they have that, We figure out which county they're looking at and determine whether or not there is a team, already a freestanding team there, or a child advocacy center there. If there's a child advocacy center there, there cannot be a freestanding team. The only county that is actually is allowed that is Oklahoma County, and that's because Children's Hospital has a child protection team, which is considered a freestanding team, and by statute that is allowed. Excuse me. But once we have figured out that the DA is on board, the county doesn't have a team, they need to start getting representatives for those core disciplines, which again, district attorney's office, law enforcement, child protection, medical and mental health. Once they identify those members, they have documentation that they have to create. They have to figure out a meeting schedule. They have some training they have to do. And they have 6 months to kind of get that process started and done, to be ready for their first review period in July. Go ahead and. So, as I said, the very first thing they would do is they would contact our office, our program, and say, hey, we're interested in starting a freestanding team. What do we need to do? And we would walk them through that process, kind of figure out where they are and what they need to do. Identifying the service area, talking to the DA, figure out which team members they have, which team members they need, and if they need help identifying who they could contact, especially for medical and mental health, because sometimes those are really difficult areas and disciplines to identify. Sometimes we can point them in the right direction to help them find those team members, especially if they are in a part of the state where DHS has a nurse that's on staff, or the health department has a nurse that might be available. Sometimes we can help them kind of find those places. Additionally, we have found that a lot of the tribes are really interested in jumping on board with some of the freestanding teams and working with them. So we have really encouraged teams to reach out to tribal members and to partner with them whenever they can. So go ahead and thank you. So from that January to July date, they have to meet monthly for those 6 consecutive months before that July 1st deadline. The first 2 meetings are really kind of developing the team. They're looking at what the structure is, what the roles are, what the responsibilities are. They're creating their protocols and their policies, understanding what the statutes say, and kind of getting all of their ducks in a row, so to speak, in order to be an effective team. The remaining 4 meetings are going to be getting that case review process started and figuring out how they're going to identify which cases they're going to staff based on what their protocols are, and start getting those cases identified and brought to the team so they can start discussing them. They're also going to start collecting their data for their annual review. The documents that they have to create and get signed, they have an interagency agreement, which the heads of the agencies and the team members that represent those agencies are required to sign that interagency agreement that says they agree to work together as a team and they are going to cooperate in that team capacity in investigating these cases, which you would think would make perfect sense, but sometimes it doesn't, especially when you have different agencies with different policies. But one of the things the interagency agreement says is we understand that we are creating a protocol to work together as a team. And we also understand that when we're creating this protocol, we're going to do so in a manner that does not contradict what an agency's policy says, because we don't want our protocol to fight against the policy. They're also creating that protocol, and statute specifically says that in their protocol, they have to create their, they have to work up how they're going to do joint investigations and what does that look like. And how are they going to contact each other and under what circumstances? When are they going to use forensic interviews and what does that look like? And where are they going to do them and who's going to do them? Pardon me. And what forensic interview model are they going to use? All of that is supposed to be included in their protocol, so everybody is on the same page. The confidentiality statement is worked up to explain how are they going to staff cases. Everybody who is in that staffing understands that the information is confidential and cannot be shared outside of the staffing. And then what's the consequence if it is? Case staffings are actually addressed in statute, that there is a criminal charge that if you breach confidentiality outside, it is a misdemeanor charge and a fine. I believe it's 6 months in jail, up to 6 months in jail, and a $500 fine. And it can, and is, for most teams, it's expulsion from the team as well. There are sign-in sheets that have to be signed for everybody to show that they've attended the meetings. And then they have to determine how they're going to collect their data. We now have a database that teams use, which requires credentials for the coordinator to be set up because it is a secure database. So when they do that, I have to get them logged in through eTeams. We have to get all of that set up. And then they have to have their financial policies because they do, once they have completed everything and they qualify for CAMTA funds, they have to have a fiscal agent set up. They have to have their financial policies that determine how they're going to set their budget, how they're going to track their money, how they're going to write their checks. All of that has to be spelled out in a policy that I actually get a copy of, and then that they understand that they are required to report everything to us quarterly, that is going to be tracked and audited regularly. There's also a basic training that all core members have to go through. We do provide a basic training. It's a one-day training that's about 6 hours long. We do it about 3 times a year. We will go to the team and provide that training to them. There are also other providers that do that. Child Advocacy Centers of Oklahoma actually does a training very similar to ours. It was actually developed at the same time. We have done that together with them in areas where there are child advocacy centers and freestanding teams, or we'll do it separately. Core members have 2 years by statute to complete this training. So we do give them a little leeway. We encourage them to do it as soon as possible. But if they aren't able to do it in that first 6 months, we understand that everybody's busy, but we do give them some time. Okay. Yeah. There we go. So then they have to choose a lead agency. There's a fiduciary agent that is going to be the one that's going to take care of the money. This can be a government agent, district attorney's office, or other entity, or it can be a 501c3. They are the ones that we are going to contract with for their CAMTA funding. They will have to be a state vendor, so they have to go through all the paperwork and approval process for that. And then if they can have everything done before that July 1st deadline, they are qualified to complete the review process and evaluation by us. If they pass that review process, then they can be eligible for funding and would be on the list for a designation of provisionally functioning, that would be brought to you for the review period. Does anybody have any questions?
Hearing no questions, what action do we need on this item?
Well, we can go ahead and go to the other presentation, which is actually going to be to get the teams reviewed for this year. So Ellen, if you'll bring up the second part of this. Thank you. Okay. So this year I am bringing to you 43 teams for approval. That is 3 more than last year. So we have 3 new teams that have requested approval this year. Those teams are Hughes County. I am so sorry. It is. Sorry, I'm looking at my map on my other screen. It is Harmon County, Hughes County, and where's my other one? Jefferson County. But when you, can you go back one? Thank you. So when you're looking at this map, this actually shows you our coverage in the state. The dark gray counties are the counties with the child advocacy centers. The dark blue counties are our counties with our already approved freestanding teams. The counties that are in green are counties that are part of those DA districts that they have one freestanding team that cover the contiguous counties. So Panhandle, that Texas County team actually covers Cimarron County, Texas County, Beaver County, and Harper County, which is why they're kind of like that. And then the county in orange, Caddo County, is actually planning on doing their own freestanding team. They just weren't quite there this year. They thought they were going to be, and they just didn't quite make it. So we are anticipating next year they are going to be asking to be on this list. So we're really excited about that. So this is my 3rd year at OCCY, and we have actually added new counties every single year, which is really, really exciting. I think we were at 38 counties, 37 counties when I started, and we are now at 43. So that is really exciting. I'll go ahead and go to the next slide. Thank you. One of the things that I have noticed in these past 3 years is the site visits between Peyton and I. We go out and personally visit every single team, and that's a lot of traveling, but it's really, really important for us to actually go out there and personally see these teams. And one of the things that I have noticed is that because we have that in-person engagement with the teams, we're actually seeing some really interesting changes. We get contacted not just by the coordinators, but we're getting contacted by team members when they need specific training. We've had law enforcement reach out to us and say, hey, I'm part of the team in Beckham County. We need this training. Is that something you can do for us? Recently, I had a district director for DHS contact me and say, hey, we're part of this team. I just have a question about case staffing because I need some guidance on how much information we can give. First time I've had that happen. She was at a training that we did about the MDT foundational training for new teams. She was new to the job. She came to the training. She had a question, so she called. And that's fantastic that they know that they can reach out to us and ask those types of questions. It's really, really exciting to think that the teams are realizing it's not just the coordinators. They have a voice in this too. Okay, go ahead and go to the next one. And just to understand how much training we do, last year we had 27 separate training events with 91 sessions because some of those events were multiple. We used 29 expert trainers. 15 of them were local, 14 of them were national. We had virtual training, in-person training, and hybrid formats, and reached 683 participants for a total of 222.5 training hours. Those training hours also provided CLEAT training credits and CLEs for attorneys. We also provided training credits for mental health professionals and medical professionals, depending on what the training was. And lots of hours on the road. I also had the privilege of having a presentation accepted, and I was in New Orleans back in June and presented at the National APSAC Colloquium to talk about Oklahoma's freestanding MDT model. Oklahoma is the only state that has two different types of MDTs and has this freestanding team model that is set up by statute and funded. So I submitted the presentation. My presentation was accepted. I actually got to go and speak at this national conference. As a result of this, I have a conference call on September 23rd with the Minnesota Children's Alliance because they are looking for a way to better support MDTs in rural Minnesota. And just so happened, somebody on that alliance was at my presentation and heard about this model and thought this might work for them. So this is exciting. This is something we do really well, and we don't get enough credit for the things that we do really well. So I'm excited about being able to do that. The database. We had some, it was touch and go there for a little while. There were some questions about it. We had some changes statutorily last year that were passed. It goes into effect November 1st, which means all of the teams will be using the database to track their data. Now, we do have 25 teams that were already voluntarily using the database for the past year. So we do have some data from that. We've already had a chance to look at that. And it's really exciting to see the things that we're able to track now. We've always been able to track the demographic information from the teams. We've always known the demographic information of the children that they've staffed, what the relationship of the perpetrator was, the types of maltreatment that the cases were, how many new cases they had, how many cases were continued. But we are actually asking questions now that are allowing us to look at things like how many cases had perpetrators that had previous allegations of child maltreatment? How many cases have had joint investigations? How many times have they utilized a forensic interview? How many times were there arrests made? We've never been able to look at that before. We just ran our first year-end report. Of course, it's only for part of the teams. But in that year-end report, because we have a section that we've asked for coordinators to go back and follow up on cases. And if there was court involvement, can you tell us how that ended? We actually know last year they had 8 criminal cases that resulted in convictions and 36 cases where there was at least one child that was adjudicated deprived. We've never had that before. So we're really, really excited about being able to see what the future holds and what kind of information we're going to be able to have with the database. Next slide. So at this time, in your packet, you have a list of the 40 functioning teams, which these are the teams that have been approved in years past, and the 3 new teams that we are asking for, we're asking to be approved as provisionally functioning for this year, for a total of 43 teams. And I would ask for you to approve those teams.
All right, well, thank you for your detailed report. Is there a motion to approve the 43 teams as presented in, oh, we have a question, sorry.
I just wanted to clarify that it is for 2026, because the first 40 is 2026, but the second actually says 2025 for Harmon, Hughes, and Jefferson.
Yes, it is. It should be 2026 for both. I apologize for that.
That's okay. With that edit, I would make the motion to approve.
Second. A motion and a second. Any further discussion? Hearing none, please call roll.
CEO Bittner,
Yes.
Director Front,
Yes.
Commissioner Hall,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurth,
Yes.
Commissioner Larson,
Yes.
Commissioners Michael Johnson,
Yes.
Commissioner Schmidl,
Yes.
Commissioner Schneider,
Yes.
Commissioner Whip.
Yeah.
Motion passes.
All right, thank you so much. Next on the agenda is agenda item number 10. Discussion and possible vote approving of candidates for the Child Abuse Training and Coordination Council, and I'll turn it back over to Brittany Gassner.
Thank you. So we've had a couple of new nominees for the Child Abuse Training and Coordination Council. We have Jennifer Austin, who has been nominated by District Attorney's Council. And then we have I'm sorry, that is not wrong. Bonnie Goodwin, who has been nominated by the Association of Social Workers. I've included their bios, at least their bios, in your packet, as well as the statute and the administrative rules that govern CATSI. At this time, I am asking for approval of these nominees.
Thank you so much. Their resumes were included in your packets. Are there any questions about these 2 candidates? No questions. Is there a motion?
Motion to approve. Second.
Can we do both at the same time?
Those seconds are.
No,
Oh,
no.
My motion was for both.
For both.
Okay, because that is the agenda item.
Okay,
Yes.
thank you for clarification.
Who do I give the second to?
It don't matter.
So there's a motion and a second to approve both candidates listed. Any further discussion? Hearing none, please call roll.
CEO Bittner,
Yes.
Director Front,
Yes.
Commissioner Hall,
Yes.
District Attorney Hicks,
Yes.
Commissioner Kurth,
Yes.
Commissioner Larson,
Yes.
Commissioner Michaels Johnson,
Yes.
Commissioner Schmidl,
Yes.
Commissioner Schneider,
Yes.
Commissioner Whip.
Yes.
Motion passed.
Perfect. Thank you. Brittany, thank you for your work and for your presentation. We appreciate it. Okay, next on the agenda is agenda item number 11, presentation and discussion of the Post Adjudication Review Board 2025 annual recommendations. And I'll welcome up Keith Pirtle.
Morning, everybody. I'm gonna share our annual recommendations to commission like we do every year. But before I do that, wanted to share, real quickly what PARB is, just a quick kind of snapshot. And to do that, I like to visualize kind of what PARB looks like. So imagine, someone in a rural community in Oklahoma who has a real heart for foster care, who really cares about kids and wants to figure out a way to contribute. So they sign up to be a local PARB member, Post Adjudication Review Board member. So that means once a month, they go to their local courthouse. They get a list of what's coming up before the judge that month on their deprived case list, and they review case files and make those recommendations to the judge. And so those can be, foster parents, retired teachers, business folks, Sierra White, lots of folks like that. So the definition of that is, what are PARB boards? They're a group of local, trained, and supported volunteers with broad legislative authority that meet regularly and monitor the active deprived docket cases and make recommendations to the presiding judge. I think they also kind of serve as mentors to child welfare as well. Those recommendations really kind of impact child welfare. A lot of times those community folks know the resources better than just about anybody because they've been in that community for a long time. The recommendations are designed to ensure child safety and connect the family to needed resources and provide feedback to the case. And I would argue a lot of times they validate what child welfare is already doing, which I think is an important role as well. So the PARB basics. So our slogan is volunteers supporting, protecting, and monitoring the deprived court system. Shelby and I always emphasize the supporting first. We're there to support the efforts of all the other court partners trying to make the world a better place for kids in custody. There is average around 300 PARB volunteers statewide. At state fiscal year, end of state fiscal year 24, there were 291. They reviewed 2,500 foster care cases and logged a total of over 7,000 volunteer hours. Mark was talking about the 4E money earlier. That's how we generate that 4E money, is submitting the volunteer hours. We have 2.5 staff. Sheriff, of course, helps with state PARB, but as far as our program staff, Shelby Tatarian, leave your hand. She's been with us just over a year and has done a phenomenal job. She supports the 7 boards for Oklahoma County, which are fairly staff intensive, and also is head of our outreach efforts, which our outreach is an ongoing task for sure. And then recently, we were able to refill the position. Sarah Lynn Miller is a contract staff person. We actually contract with the Juvenile Bureau out of Tulsa County, which we really appreciate that contract, because otherwise we don't have that slot at the commission. So that helps us serve that area. They have 5 boards there that Sarah Lynn manages. And then I do the other 75 counties. So I drive around a lot and work with our state PARB as well. And so I want to show you our map. So the legislation in 1981 said there will be established a Post Adjudication Review Board in all 26 judicial districts. So those pie shapes are the judicial districts, and the color is where we're at. So for example, this is a district. We have a board in Cushman, Tahoe, but not in Choctaw and McCurtain, for example. So if it's gray, like we're not in the Panhandle, we're not in the Jackson County area. So, those are areas that we currently do not have coverage. So that's why we're doing, we're constantly doing volunteer recruitment and going out and meeting with folks. We're also supposed to review every deprived case every 6 months. So, that's around 5,500, 6,000 cases, I think, on average in Oklahoma right now. We review about 2,000 cases annually, or 2,000 unique cases. So we're hitting about a quarter to a third of those cases. We need 600 volunteers statewide and about 3 more staff to hit the pavement. To follow that statute. Other states are pretty staff dependent. We're volunteer dependent. So right now we have 40 active boards, 7 in Oklahoma County, 5 in Tulsa County, and then the rest of the state in 22 judicial districts. We just this last month or this week, we relaunched Canadian County, which is great because it's a district as well. And we added Atoka County recently. But we lose boards sometimes too, because people don't want to do this anymore. They want to do other things. And so, you know, boards fall apart sometimes. One of the things you've heard about the E-team and the databases, they collect our recommendations and we put our recommendations into category areas. And so this is kind of, if you look at the bottom, that's the category that kind of hits the most, which is permanency planning and placement and mental health services. So just wanted to kind of share that with you. I'm just doing a quick overview today, or I could show you a whole lot more statistics. So we also have our state level body that Dr. Kurth is on, and it's made of 23 members appointed by the governor. We have 2 agency appointments, one from OJA and one from DHS. And we have, and you'll see in your recommendations packet, it has a list. Looks like this. They've got a list of our current members. So we have judicial judges there, judicial folks there. We have foster care. Our chair is Sarah Arian from the Foster Care and Adopters Association. So they meet 3 times a year. And so their kind of tasks are overseeing the PAR program in partnership with OCCY. So they give me some direction. They make policy recommendations to the courts, agencies, and government officials regarding kids in, you know, foster care. And obviously they try to identify and solve issues in the system itself. And then, you know, why I'm here today is to talk about, they also submit a report of activities and findings and recommendations to the Commission on Children and Youth every year. So again, you have that in your packet with some explanation. We start every year by asking local boards if they have systemic issues that they want to move forward, that they're concerned about. And so a lot of times those can be somewhat anecdotal. And one perception that local communities seem to have, and I have no doubt that it's true, is the time to initiate services when a kid comes into custody and comes into care. Foster care system can take a while, especially in rural communities, and that, you know, mental health services are always really needed. I don't know if everybody was aware of House Bill 2030 that made it quite a lot longer this last year than most people thought, which was a effort to increase foster care payments $5 a day. We were talking about staff salaries earlier that, you know, were kind of under the bar. Well, foster care payments in Oklahoma are very much like that too. You compare nationally and we're not even close. So our state PARB wanted to get behind that effort. We felt like, you know, that's certainly a no-brainer, and want to get behind that effort and add our voice behind that. The next one is remove barriers that create challenges from the Oklahoma's Promise Scholarship Program. There was some discussion that some of the eligibility that they include the, you know, parents' income. So that can kind of be a detriment to getting some people signed up. So we're exploring that issue some. And then one that, you know, I'm excited about, and I know because the governor's task force on child welfare, you know, a couple of years ago, improvements into the individual service plan was a big deal, was something that they came up as a recommendation. Our state PARB also felt that was true as well, and I certainly hear that in the field. I know, I'm blanking on her name, but we had some staff from child welfare actually present at our annual PARB conference and talk about the improvements they're trying to make to the ISP. And we've partnered with Megan Rourke and others to kind of help support that efforts. Because one thing you need to know with PARB is we've got a unique opportunity when we have local volunteers that have a really close relationship with the permanency staff in that county. And they can share information, they can check on things. So if you hear from state office things they're trying to implement, we have local park boards that can make sure that it's actually being implemented. So that's kind of a nice thing. So our state PARB certainly wants to support the efforts of whatever they are to improve the user-friendly nature of individual service plans. So that is it.
So much. Anybody have questions? Comments? Okay, well, thank you for your report and thank you for your work. Appreciate it. Okay, moving on is agenda item number 12, presentation and director's report.
I just want to say, thank you to everyone. I've been gone and apparently when I came back, I decided to become really ill. So I haven't been around much this past week. I've been in and out of doctors. And I want to thank Mark and Maboob for taking something that we worked on early, like in theory and like putting all the detail to it. It was so thorough and I really appreciate it. I want to give kudos to PNC. They had an interim study sometime this week and I watched some of it until I had a coughing fit and had to leave, but it was amazing. All of the parent partnership board members presented. I think it was all of them, most of them, if not all. And they shared their stories with solutions of what would have made their journey easier, better, more successful. And it was very impactful. And you can watch it online. It's archived if you want to do that. But I thought it was just tremendous. And Isabel, you did a great job of just organizing that and getting everyone ready. It was really good. There's been a lot going on and I'm sorry, I just haven't felt up to doing much this week and I will get back on my game after this weekend of sleep. So I'll get a report out with numbers. Everything looks pretty much the same. I mean, there's nothing too exciting or different right now, but the first thing in order of business is October 1 in our budget request. So thank you, Mark and Maboob, for making that happen. Very much so.
Yeah,
That's it.
perfect. Thank you so much. I hope you get to feeling better.
I will.
It's
Ridiculous. It's ridiculous.
Agenda item 8, or nah, not 8, 13 is chairperson remarks, and I don't have any further remarks today other than thank you for coming. Thank you for making the time to be here and making this a priority with a long agenda today. So are there, with agenda item 14, are there any announcements that the commissioners would like to share? Hearing no announcements. It's time for lunch. Okay, agenda item 15, adjournment. Is there a motion to adjourn? So moved. Motion to adjourn?
Second.
Second, any further discussion? Any vote? No vote, okay.